10 Skin Signs That Could Reveal Diabetes. Part 1. Hello, Health Champions. Let me start with a question. Have you ever looked in the mirror, noticed something strange on your skin, and just brushed it off as nothing serious? Maybe a dark patch on your neck, a few stubborn skin tags, or even some redness on your face that you assumed was just rosacea or irritation. What if I told you that your skin could be whispering, sometimes even shouting a warning that your blood sugar is out of control, that your insulin is running wild, or that you may even be at risk for diabetes, long before a blood test confirms it? Today, I'm going to walk you through 10 skin signs that can point toward diabetes or poorly controlled blood sugar. But here's the twist. Not all of them are obvious. Not all of them are exclusive to diabetes, and some are so strange that even doctors misinterpret them. And if you stick with me all the way, not only will you understand what these signs are, but you'll also discover what they really mean inside your body and how you can take back control before it's too late. Before we begin, a little medical secret. Doctors have a word we use, pathognomonic. It's a fancy term that means if you see this one sign, you can almost guarantee the diagnosis. But here's the reality. Very few signs are truly pathognomonic. Most of what we see on the skin can have multiple causes: allergies, autoimmune conditions, nutritional deficiencies, and yes, diabetes. So I don't want you to hear one of these signs, rush to Google, and panic. Instead, I want you to learn how to collect clues. Think of it like detective work. One clue means very little, but when several start lining up, the picture becomes clearer. Alright, let's dive in. Sign number 1. Dark velvety patches, acanthosis nigricans. Imagine you're at the gym. You glance in the mirror while adjusting your shirt, and you notice a darker, slightly thickened patch of skin on the back of your neck. Maybe you scrub it in the shower, but it doesn't go away. That's acanthosis nigricans. It often appears in the folds and creases, the neck, armpits, groin. It may feel a little velvety to the touch, and while it's harmless by itself, it's like a red flashing light for insulin resistance. Think of it this way: when insulin levels are constantly elevated, your skin cells start to overgrow and overproduce pigment in those creased areas. Now, here's what makes it fascinating. If you have these patches, it doesn't prove you have diabetes, but it strongly suggests that your body has been fighting insulin for a long time. It's often one of the earliest outward signs, especially in children or young adults who may not yet have abnormal blood sugar tests. I once had a young patient whose parents thought he just wasn't washing properly, but the reality was, his pancreas was already under siege. That dark patch was his body's SOS signal years before his blood sugar climbed high enough to earn a diagnosis. Sign number 2. Angry inflamed patches, necrobiosis lipoidica. Now, this one sounds like something out of a horror movie. Necrobiosis lipoidica. Let me decode that. Necro means dying. Bio means tissue. Lipoidica refers to fat-like. So essentially, it's describing tissue that's degenerating, inflamed, and looks waxy, yellow, or reddish-brown. These patches usually appear on the shins. They're not common, thank goodness, but when they do show up, they're strongly linked with autoimmune diabetes type 1 more than type 2. That alone tells us something important. It's not always just about sugar. It's about the immune system misfiring. Now imagine, you're wearing shorts. Someone points at your leg and asks if you burned yourself. You haven't, but those strange patches are there. They don't heal easily, and sometimes they break down into ulcers. Scary, yes, but remember, it's rare, and it reminds us of the bigger truth: your skin is more than a cosmetic cover. It's a map of what's happening internally. Sign number 3. Balding. Is it really about diabetes? Let's talk about something many men dread: baldness. Now, I know what you're thinking. You've heard claims like male pattern baldness is linked to insulin resistance, and while it sounds like a juicy connection, the truth is, not so fast. Male baldness is driven mainly by genetics and hormones, specifically DHT, dehydrotestosterone, a byproduct of testosterone. Receptor sensitivity, how strongly your follicles respond to DHT. Here's the kicker. The genes for this sensitivity sit on the X chromosome. Men have only one X. If it's coded for baldness, tough luck. Women have two X chromosomes. One bad copy, the other often saves them. So, baldness is not really a reliable diabetes sign in men. However, in women, things get a little more interesting. If a woman has insulin resistance, her body may convert more estrogen into testosterone. That means more DHT, and potentially some thinning hair. Not classic male baldness, but a hint of hormonal imbalance tied to insulin. Bottom line, for men, baldness is mostly genetic. For women, if thinning hair shows up with other signs, insulin resistance could be at play. Sign number 4, painful boils, hidradenitis suppurativa. Next up is something many people suffer in silence with, hidradenitis suppurativa. The name sounds like a spell from Harry Potter, but all it means is hydra equals sweat, adeno equals gland, itis equals inflammation, suppurativa equals oozing. So basically, inflamed, oozing sweat glands. These show up as painful, swollen boils in areas where skin rubs together like the armpits, groin, or under the breasts. They can be recurrent, scar over, and even form tunnels under the skin. And yes, research suggests that insulin resistance and high blood sugar may worsen this condition. Why? Because excess insulin drives inflammation, and poor sugar control damages small vessels and immune responses. I've had patients embarrassed to even bring it up. They thought it was just acne. But when we improved their diet, cut down carbs, and restored balance, the outbreaks often decreased dramatically. Sign number 5, blisters, bullous diabeticorum. Now let's look at something really peculiar. Diabetic blisters. Imagine waking up and seeing a large, fluid-filled blister on your leg or foot. You didn't burn yourself. You didn't injure it. But there it is, like something out of a science fiction movie. Doctors call this bullous diabeticorum. They're usually painless. They may look scary, but they often heal without scarring. The problem? They're a marker of poor blood sugar control, usually in long-term diabetes. Now, here's a word I want you to pay attention to. Management. Traditional medicine often says, this happens in poorly managed diabetes. But what do they mean by managed? They mean taking insulin or metformin to lower blood sugar numbers without actually fixing the underlying problem. In my mind, manage really means you'll keep the disease forever. But what if, instead, we talked about reversing? By changing lifestyle, by reducing sugar and carbs, by moving more and restoring insulin sensitivity. I've seen patients stunned when, after 20 years of managing diabetes, they finally start reversing it by making real changes. Sign number 6, skin tags, the flaps that tell a story. Let's move on to something common. Skin tags? You know, those little flaps of skin that dangle, often around the eyes, neck, or armpits. People often think of them as harmless, just a nuisance. But here's the hidden truth. They are strongly linked to insulin resistance. High glucose and high insulin create the perfect environment for skin tags to form. Think of them as miniature warning signs. If you start noticing more and more skin tags, your body might be shouting, "Hey, stop overloading me with sugar." The good news: when people clean up their diet, lower their insulin, many of these tags shrink, disappear, or at least stop multiplying. Sign number 7, rosacea. When redness tells a bigger story. Rosacea. The word itself doesn't say much. It simply means redness. But to the person who has it, it can be frustrating, embarrassing, and confusing. You might see persistent redness on the cheeks, nose, or forehead, flare-ups that look like acne, sensitivity that worsens with heat, alcohol, or stress. Now, here's the key. Rosacea is not exclusive to diabetes. It overlaps with eczema, psoriasis, allergies, and even gut imbalances. But when we see rosacea together with other insulin resistance signs, it starts to paint a bigger picture. Why? because high insulin promotes inflammation throughout the body, including the skin. Your blood vessels dilate more easily, your immune system becomes hyperreactive, and your skin starts wearing the stress of your metabolism on the outside. The lesson: don't dismiss redness as just cosmetic. It could be your body's way of saying, look deeper. Sign number 8. Yellow patches around the eyes, xanthelasma. Now for a word that sounds like it belongs in a Scrabble championship. Xanthelasma. It looks like this: yellowish, scaly patches on the eyelids, often near the inner corners. Soft, painless, harmless but not meaningless. Xanthelasma represents cholesterol deposits. They don't hurt you directly, but they signal that your body is struggling to process cholesterol and fats properly. Here's the deeper truth: I'm not afraid of cholesterol itself. It's an essential molecule. The real problem is when your body can't handle it, when it's depositing in the wrong places. That's when you want to ask, is insulin resistance interfering with fat metabolism? Is inflammation preventing proper repair? So, while you can ignore xanthelasma cosmetically, you shouldn't ignore the metabolic message it carries. Sign number 9. Acne. More than just teenage trouble. Most people associate acne with hormones, puberty, and poor hygiene. But there's another culprit: sugar. Teenagers today consume more soda, processed food, and refined carbs than ever, and acne thrives on that. Why? High sugar spikes insulin. High insulin increases oil sebum production. More oil means clogged pores, feeding bacteria, causing inflammation. And while teenagers don't usually have diabetes, the pattern is the same. Too much sugar gives too much insulin, gives skin eruptions. For adults, if acne continues long after the teenage years, it's worth asking, is this a sign of insulin resistance lingering in the background? The skin is once again revealing the story inside. Sign number 10. Ulcers, the closest thing to a guaranteed sign. Now we arrive at the most serious sign of all: diabetic ulcers. These are open wounds that don't heal. They usually appear on the feet or lower legs, and they can become infected, painful, and even lead to amputations if ignored. And here's where that special medical word pathognomonic almost applies. Because if you see non-healing foot ulcers, there is a very high chance the person has diabetes. Why? High sugar damages small blood vessels. Poor circulation starves tissues of oxygen and nutrients. Nerve damage, neuropathy, means you don't feel small injuries. Combine those factors, and wounds simply don't heal. This is not just cosmetic, it's life-threatening. And it's one of the most powerful reminders that diabetes is not something to manage. It's something to reverse before it progresses this far. The bigger picture. What do these signs really mean? Now, you may be thinking, okay, Doc, I've seen some of these signs. Now what? Am I doomed? The answer is no. These skin signs are alerts, not sentences. They're like the check engine light on your car. If you address the underlying problem, you can often stop the damage and even reverse it. So let's talk about what's happening under the hood. Insulin resistance, the real culprit. Most of these signs point not just to high blood sugar, but to chronically elevated insulin. Think of insulin as a key that opens the door to your cells, allowing sugar glucose to enter. But when you eat sugar and carbs constantly, your body pumps out so much insulin that your cells eventually say, enough. They resist. They stop responding. That's insulin resistance. And what happens next? Your pancreas pumps out even more insulin. High insulin triggers skin growth, tags, patches. High insulin drives oil production, acne. High insulin increases inflammation, rosacea, boils. Blood sugar rises anyway, damaging vessels, nerves, and tissues, ulcers. So, really, these skin signs are reflections of a deeper storm: too much insulin for too long. Testing your body's warning lights. If you notice any of these signs, the next step is not to panic, but to measure. Here are the key blood markers I want you to pay attention to. Hemoglobin A1C HbA1c measures your average blood sugar over 3 months. Officially, under 5.7 is considered non-diabetic, but optimal health. Keep it under 5.3. Fasting insulin. Most doctors don't even check this, but it's crucial. You want it under 5. Ideally 2 to 3 if you're insulin sensitive. The official range says under 25 is fine, but if you're at 24, you're already 20 years down the diabetes road. C-peptide, made in equal amounts with insulin, useful if you want to know whether your pancreas is still producing insulin, especially in type 1. Triglycerides, officially, under 150 is normal, but if you're insulin sensitive, you should be under 100. Many low-carb eaters are in the 50 to 80 range. VLDL, very low-density lipoprotein. Another way to look at triglyceride handling. Official cutoff is 40, but under 20 is better. These numbers tell the story long before a fasting glucose test ever does. Reversing diabetes, not just managing it. Now, let's get practical. Traditional medicine talks about management, meaning take metformin, take insulin, keep eating the same foods, and live with diabetes forever. But I want you to think differently. Think reversal. Yes, type 2 diabetes is reversible in nearly every case. Type 1, being autoimmune, is not curable, but even there, lifestyle changes improve health dramatically. So, how do we reverse? Step 1. Change the fuel. Most of the problem starts with one thing: too much sugar and carbohydrate. Stop drinking soda. Stop living on bread, pasta, rice, cereal, and snacks. Cut back on desserts. When you do this, you lower the insulin load immediately. Step 2. Choose the right eating style for you. There isn't one magic diet, but there are proven approaches. Paleo. Eat like our ancestors. Eliminate sugar, processed foods, grains, and dairy. Eat meat, fish, vegetables, nuts, and fruit in moderation. Low-carb, high-fat LCHF. If you're still insulin resistant, tighten up further. Cut starchy vegetables and most fruits. Ketogenic. Reduce carbs to less than 5% of calories. Burn fat for fuel. Enter ketosis. Ketovore, carnivore, very low carb, mostly animal-based. Can help especially when food sensitivities or autoimmune issues are involved. Autoimmune paleo AIP. Strict elimination, cut grains, dairy, processed foods, plus nightshades and lectins. Each of these is a tool. The right one depends on how advanced your insulin resistance is and how your body responds. Step 3. Move your body. You don't need a marathon. You just need movement. Walking after meals lowers blood sugar dramatically. Resistance training builds muscle, which soaks up glucose. Short, intense bursts height improve insulin sensitivity. Think of your muscles as sugar sponges. The more you use them, the less sugar stays floating in your blood. Step 4. Respect recovery. Diabetes is not just about food, it's about stress and recovery. Sleep. Poor sleep wrecks insulin sensitivity. Stress. Cortisol raises blood sugar. Manage it with breathing, meditation, prayer, or whatever calms you. Fasting. Intermittent fasting gives your pancreas a rest, lowers insulin, and accelerates reversal. The real question: do you service your body like your car? I want to leave you with this analogy. Most people take better care of their cars than their bodies. Oil changes every 5,000 miles. Tune-ups before problems start. But when it comes to our health, we often wait until the engine blows, until the ulcer forms, until the amputation is scheduled. Don't do that. Treat your body better than your car. Notice the warning lights. Respond early. The takeaway. Let's review the full 10 skin signs one more time. Dark patches, acanthosis nigricans. Inflamed patches, necrobiosis lipoidica. Baldness with caveats. Painful boils, hidradenitis suppurativa. Blisters, bulosis diabeticorum. Skin tags, rosacea. Xanthelasma, yellow patches on eyelids. Acne, non-healing ulcers. Each one is a clue, not proof, but together, they're your body's way of saying, pay attention. Fix this before it's too late. And the fix is not complicated. Eat real food. Cut sugar and carbs. Move your body. Sleep. Recover. and manage stress. Test the right markers, not just fasting glucose. Do this, and not only can you prevent diabetes, you can often reverse it, even if you've had it for decades.